Okay, thanks everybody. Coffee break over officially. So now I'd like to invite up today's panelists, Michelle Nochisaki with MCE, Damian Hardman, Contra Costa, Michael Kent with Contra Costa, and Brett Bishop with Build It Green. So how this is going to work is each panelist is going to do a short presentation on their program. First is Michelle Nochisaki, so we'll invite you guys out to the podium when you do your presentations. And also, Will Domney is going to be moderating the panel and taking questions for after everyone has presented.
Thank you, Kellen. Okay, so I have the pleasure of moderating this panel today. And I just wanted to kick it off before we get started by hearing a little bit more about who is in the audience. And we already did kind of like what specific agencies you work for or organizations. But I do want to hear just like by sector, back to this question of like how are we kind of building across sector. Who here is public health? Okay. What about local government sustainability staff? All right. Private sector? Others? Oh, wow, a lot of others. Okay, great. All right, excellent. So we're going to dive in. And as Kellen mentioned, Michelle Nochisaki is going to get us started. And Michelle is the Customer Programs Manager with Marin Clean Energy. And she joined Marin Clean Energy's Customer Service Programs team after 2 years of leading green and healthy home initiatives efforts in Marin County. She brings 9+ years of experience in energy efficiency and building performance industries. She's focused on building strategic partnerships and innovative financing for the Marin Collaborative. She manages the current program implementation while exploring new opportunities for Marin Clean Energy to provide comprehensive services to its energy efficiency clients. Prior to her work there, she led several national and regional programs focused on expanding the energy efficiency contractor market as education and development manager for Efficiency First. Okay, take it away, Michelle.
Whoops, got ahead of myself. Thanks, everyone. Good morning. Michelle Nochisaki, MCE, here to talk to you about Green and Healthy Homes Initiative Marin. I was tasked with introducing GHHI National as well as our local program and going over a bit of the lessons learned from our work in Marin the past 3 years. No surprise to any of us, unhealthy homes equal unhealthy families. And there are billions of dollars spent every year on preventing asthma, slip and fall injuries, lead poisoning, in addition to when you live in an unhealthy home, that usually means missed days of school, missed days of work, and all of that just accumulates into what could be preventable if we focused on the environment in which folks live. We talked a little about silos earlier. So GHHI National actually started out as the Coalition to End Childhood Lead Poisoning in Baltimore, Maryland. So again, they were focused on lead poisoning prevention. And essentially GHHI was started because they were going into homes, they were mitigating the lead hazards, and they were looking around the homes and saying there's a lot of other work that needs to be done here in order for these individuals to live in a healthy and safe environment. So they decided to take a step back and say, okay, we're going in, we're taking care of the lead. Who's taking care of the other services? And essentially what you ended up getting was a very siloed model, all starting from the funding. The funding trickles down to a specific agency to provide a specific service, so on and so forth. And what that means ultimately for the client, for the individual residents, is that for them to take advantage of those services, that's multiple assessments, multiple applications, just multiple intake streams that create a large burden, and a lot of times people who need these services the most won't end up taking advantage of them. I'm going to skip over this slide for a minute. So what the Coalition to End Childhood Lead Poisoning did was essentially partner with the CDC, HUD, Coalition of Philanthropies, the White House, and essentially created this GHHI model focused on no wrong door when it comes to funding and a comprehensive assessment. Essentially, once you get your foot inside of the home, you should be looking at every and all things that could impact that home's health, comfort, and safety. And so essentially what they did, again, partnered with philanthropy, state, local, federal funding, private sector funding, used that to funnel down into a single intake system, comprehensive assessment, coordinated services, integrated interventions, cross-trained workers, and shared data. So what they did was they went from being, Coalition to End Childhood Lead Poisoning, only focused on lead. In the Baltimore office, they brought in a weatherization services. They started an asthma program. They started an aging in place trip and fall program, and essentially cross-trained all of the workers so that when a referral comes in, that assessment truly is comprehensive, and then it will go through the necessary programs that they operate under one roof. So enter GHHI Marin. Marin Community Foundation actually brought together a group of partner agencies in Marin County underneath their environmental initiative. They had heard about Green and Healthy Homes initiative, and they said, we here in our community have disadvantaged communities and underutilized programs and services. We realize that there's a burden given how siloed our services are currently being delivered. And on top of that, we also have a large senior population that is lacking the resources to age in place. So what can we do? And so they brought together stakeholder partners, which logos are on the next slide because this one would look too circusy, and essentially decided that we were going to focus on or start from the resource conservation, so utilizing our energy efficiency partners, and expand into home rehabilitation, independent living, and overall health and safety within the homes. Again, guided by, the theory that if we can create a seamless access to the services and the rebates, the incentives that allow people to obtain this work, will essentially just be improving the lives of Marin County residents overall. So I'll go ahead and list off our partners here. We work with Marin County, both Health and Human Services and the CDA, which means then we have access to the CDA's programs like BayREN, BACMUD, et cetera. MCE Clean Energy, utilizing our energy efficiency programs. Marin Center for Independent Living, utilizing their aging in place, social services, case management, and also accessibility home improvements. Marin City Community Development Corporation, different social service programs, as well as a referral partner. Again, Health and Human Services, referral agencies there coming from Aging and Adult Services, referring out to in-home support services, as well as just utilizing partners that work in that space or that are currently partnered with HHS to refer in and out of our program when folks are in need. Community Action Marin, Age Friendly Sausalito, Commission on Aging, Strategic Energy Innovations. Again, all of those are partners that refer in and out based on the population that we're trying to serve. And Central Coast Energy Services, which is the Marin County's LIHEAP provider. So one of the things I was tasked with was to talk about lessons learned. And you'll notice that this slide is titled Current Model. So one thing that I want to just address here a little bit is that when GHHI Marin, this model was first brought to Marin County, we were utilizing, hold on one second. I read off all the partners and ignored everything else on the slide. Essentially, our program is a low-income program. We right now have a cap of 80% AMI in terms of income eligibility. What we did there was Marin Housing Authority utilizes that as their max capacity. So although we don't traditionally serve folks that are at 80% AMI, we wanted to have as flexible funding as possible, so we went with the highest tier income eligibility. We're serving single family, multifamily, mobile homes, and floating homes, owners and renters, and currently our funding streams are leveraging partner programs and resources, and we also are lucky enough to have flexible grant funding. I say currently because now I'll jump ahead to the other slide, in that when we first started this model, it truly started out as a collaborative approach. So we were utilizing just the current services that were available in Marin County. We did not build out any comprehensive model. We were trying to piece together assessments, intakes, services, et cetera, from the existing partners in order to comprehensively serve clients that way. And what we realized is, and I'll get to some of this later on my lessons learned slide, was that that wasn't easy to do. Even though we have fantastic partners offering a wide range of services, when you're truly doing comprehensive work, flexible funding is a must. Because again, if we look back at that traditional siloed model, there's holes. And so to truly leave the home a green and healthy home, we needed additional funding, and we needed to build out our programs. And so our current model, what we've done is we've split our model into a multifamily sector and a single family sector. And so we work off of the MCE multifamily program, which is now also partnered with the Bayren for the multifamily side. And we utilize our LIHEAP partner for our single family side. And essentially what we did was we took the energy efficiency technical assistance providers, the energy efficiency auditors, and they went through comprehensive training to do assessments on health and safety, to develop comprehensive scopes of work that include essentially all items in a home, from the energy efficiency to the health and safety to the home rehab, in addition to social service referrals. We added in a pre and post survey with the idea of collecting more data and information from the clients on the current conditions of their home, and other services that they might be interested in and or other needs that we're not aware of when we go into the home visit. And essentially built out both that multifamily and that single family model to really just do all that we can while we are in the home. Energy auditors go out, and the second you enter someone's home, that's kind of a big deal, right? It's not every day you just invite any random person into your home. And so, if you get to that place where you're there, you're in the home, really what we should be doing is just expanding that and looking at all other areas that we can work with. And again, even if we don't have the resources or capacity to service all of the needs, at a minimum, referring out. So energy efficiency folks to the public health folks, and public health folks to the energy efficiency folks. So that's exactly what we've done here. We've built out both the single family and multifamily model with referring out to our other partners, whether they're providing actual in-unit measures and modifications, or social services, CalFresh enrollment, case management services, et cetera. So to kind of build out that comprehensive, robust programming. So some more lessons learned. You'll notice the first one I have up here, partner buy-in and support. This isn't necessarily a lesson learned. I'm lucky enough that I have fantastic partners in Marin County, but I'm telling you right now that the work won't get done unless every partner is bought in and willing to go through the work. Because when you take any program that's traditionally, siloed, it takes a lot of coordination. It's a lot of change, which I know we all love, to kind of work on that more comprehensive approach. And you need folks who are willing to do the work with you. Project management is key, especially when you are working with more than one program and services are being provided by more than one program. There's an order of operations in order to improve the home correctly, right? And so there's timing and service coordination that needs to take place, and you need partners that are willing to do that work with you. Data sharing. Data. we all need it. It's what we need to show that the programs that we're running are actually, having an impact and doing the things that we want them to do. But with data sharing comes a lot of, privacy information, and especially when you're going across agencies and across different networks, it can be a challenge. So you need to have the right documentation in place, right privacy measures, et cetera, and not to mention a database. And so again, that's another challenging piece of it. I touched upon the coordinated versus comprehensive approach. But coming out of that, another lesson learned is just the programs you're working with, programs across the board, right? We all kind of fit in this space. Funding may be unknown, resources and capacity may change over time, and so all of that needs to be factored in. If you're factoring those services and those programs into your model, you need to take into consideration all things that could impact and affect that program's life cycle. Residents' trust in programs. We've noticed this in a couple ways. We have a pre and post survey. We're trying to collect the data to see how we are impacting these individuals' lives. Again, it's not every day you have someone in your home. It's not every day you have someone in your home and now they're asking you a bunch of questions you never thought they'd ask you, right? And so building up that trust with residents, utilizing community partners that the residents already trust to either help fill out applications, help fill out those surveys, or to be the ones to refer individuals into the program, end up being good tips and tricks. Flexible funding. Again, flexible funding for us has been a lifesaver on one end, that we have grant funding that we are able to use and, fill in for existing services that we don't have. At the same time, even with my grant funding, there are restrictions. We talked a little earlier on that San Francisco slide about multifamily homes and how do we serve those individuals that are renters and that are truly living in poor conditions. Even with my funding that is able to go to multifamily homes, it's restricted to specific multifamily homes, right? And so I think if we're truly wanting to improve across the board, flexible funding is just a must, and it's something, to factor in. And then education and training for all parties involved. Again, public health side, energy efficiency side, any of your community partners that you're using as, referrals or references, community support. Like I said, we took our energy efficiency auditors and put them through comprehensive health and safety training, and did that for two reasons. Again, from the get-go, GHHI Marin said they wanted to start with energy efficiency and build off, so that's what we did. We also thought it would be less complicated to take a health and safety individual and put them through an energy auditing training. But at the same time, an improvement on our program and something that we're working towards is how do we get the public health individual, how do we get the caseworker to truly partner and go out with us? So that sure, there is a comprehensive energy, health and safety environmental assessment, but there's also that healthcare worker there with us going out and maybe doing the pre and post survey and asking more of those questions to folks. So those are my lessons learned, but I'd like to end on a high note. And so I'll go over some case studies, some things that we've done. So this was 4 Section 8 units in Fairfax and Marin County. There were 2 senior residents and 2 residents with special needs. We were able to do home rehab work, energy efficiency work, safety, and accessibility work. This was a group project between MCE, Clean Energy, and Marin Housing Authority. Things were done, everything from like replace windows, install tankless water heater, LED shower aerators, and we were also able to take care of the pest infestation, provide security lighting, provide an ADA bathroom, ADA handrails, deck repair, which overall, lowered utility bills, provided savings, increased indoor air quality, remove trip and fall hazards, and increase the comfort and accessibility for the residents who live there, which is ultimately the most important thing. I didn't realize I animated these slides. Another example, Marin Villa. So this is located in the canal in Marin County, 12 low-income units. Again, we were able to do home rehab work, energy efficiency, and safety work that was needed on the property. This one is a great example of, layering various programs as a way to, especially for multifamily buildings, which end up being a headache for all of us because of the split incentives. So we are essentially able to layer the multifamily energy savings program with an in-unit multifamily program, the low-income families and tenants program, with a low-income solar program, and then also with the GHHI Marin funding that we had. So electrical panel upgrades, took care of some dry rot issues, CO monitors, LEDs, solar system. The electrical panel upgrades were in really bad shape, so that was a tremendous fire hazard that we removed right there. Increased the comfort, increased the structural safety, lowered the utility bills, and increased the indoor air quality.
I think the examples are super helpful, and also, can you move towards the end?
Yes.
Thank you. But they are really
Where's
helpful to be able to visualize.
I'm like totally ignoring them. Well, this is the last one. There you go.
Awesome. Thank you, Michelle.
I'll just leave it up there.